I have sought recognition to address the subject of health care reform. I support President Obama's call for health care reform legislation this year. It has long been obvious that there is a need for health care reform in the United States. There are some 47 million people, perhaps more, the precise figure is not really known, who do not have health insurance or who are underinsured. And I have prepared an extensive statement outlining some of the issues which I think ought to be addressed, and I have sought recognition this afternoon to summarize those comments briefly, and at the conclusion of my statement will ask consent that the full statement be included in the record as if read in full.
Objection.
The question of health care coverage has long been debated in the Congress of the United States. There's a general consensus that we need to cover all Americans who, as I say, either have no insurance or are underinsured. In my capacity as ranking member or chairman of the Appropriations Subcommittee on Labor, Health, Human Services, and Education for more than a decade, I have taken the lead along with Senator Tom Harkin, then on a bipartisan basis, where we, as we have said frequently, have shifted the gavel seamlessly to provide for a great deal of health care coverage. And during that time, the issue of funding for the National Institutes of Health has received special attention, where that figure has been raised from some $12 to almost $30 billion. And with the recent stimulus package, an additional $10 billion has been added. In addition to extensive coverage and increase in funding for the National Institutes of Health, which resulted in very substantial improvements in the health of Americans on items like stroke and cancer and heart disease. That subcommittee has taken the lead on many, many other health care issues, which I will not take time now to enumerate. I have co-sponsored the legislation proposed on a bipartisan basis by Senator Wyden, Democrat of Oregon, and Senator Bennett, Republican of Utah. I've had discussions with a series with Senator Baucus, Chairman of Finance, have discussed the issue with Senator Enzi, ranking on the Health, Education, the Labor Pension Committee, have directed my staff to work with the staffs of all the other senators, noted the comment made by Senator Grassley when he came from a meeting of at the White House of the interest in a bipartisan approach. Noted Senator Enzi's statement that it was his hope that we would have a consensus perhaps for as many as 80 senators, which I think is the objective. But one way or another, I do support what the President has said about moving for health care insurance at this time. It is my preference, my position, that we rely principally on the private sector. I think it is undesirable to put a massive bureaucracy between the doctor and the patient. I am open to some intervention on a public plan, as I delineate in my formal written statement. Pennsylvania has a plan where when the insurance was unavailable on medical malpractice, that the state stepped in with an insurance plan, and then when insurance was available, the plan was to have it phased out. I have noted with interest the suggestions made by Senator Schumer to have a public sector for a number of dimensions. One is to cover areas where there are no private plans. Certainly that is something that ought to be considered so that every one has the availability of health care coverage. Senator Schumer's proposal further delineates the standing of a public plan to be on a level playing field with the private sector, and has specified a number of issues where that level playing field would be maintained, and they are specified in some detail in my written statement, although not exhaustive. Here again, it is a matter for discussion and deliberation. Health care reform is an opportunity for the United States Senate to verify and confirm its standing as the world's greatest deliberative body. And all of these ideas are in their formative stages, and plans are being worked on. We have the Wyden-Bennett model. I joined that plan, not that I thought it was perfect, and in my floor statement, adding my co-sponsorship, specified the concerns I had, but I thought it was highly desirable. At that time, there were some 14 senators, equally divided between the two parties, which provided a critical mass. And I thought that that was a good start to give impetus. And of course, with President Obama's emphasis, with his convening a forum on health care where I was invited to attend and did participate, we're moving forward. And I would conclude by emphasizing my thought that all Americans need to be covered with adequate health care insurance, and that this is a matter of the highest priority. It's President Obama's #1 priority, as I understand it, and I think properly so. And I'm prepared, as I've said before, to put my shoulder to the wheel to try to get this job done. And the experience from the subcommittee on appropriations for health and human services provides some insights and some guidance, and it is something which I think we ought to accomplish.